Kimberly Leupold, and I am the owner and founder of Holistic Healthcare Centers and founder of Riley's Rainbow. The Holistic Healthcare Centers was established in 2013, and then my junior executive assistant helped me found Riley's Rainbow. His name happens to be Riley, back in 2017. So I'll tell you a little bit about both at the end. But right now what I'm going to talk about is how things like acupuncture, chiropractic care, physical therapy can be used during pregnancy and postpartum care. The first thing I want to mention is that it does not take the place of seeing your regular MD. So you still need to have your OBGYN, you still need to kind of go to all of your visits, but what it can do is help with issues that may come up. So raise your hand if you are pregnant or recently had a baby. Okay. So one thing that we do a lot is we work with fertility, but you guys already got that covered, so we don't need to talk about that. But during pregnancy, did any of you have any issues with morning sickness or aches and pains? So acupuncture can help a great deal with all of that. So acupuncture, it might not take away morning sickness, but it can help reduce that nausea and that queasy feeling. The reason I say it might not take it away is that we do not want to stop that hormone production. You have that because your body is going through these hormonal changes, and if we just take it away, then we're impacting your hormones in a negative way. But it can definitely decrease it. We call morning sickness counterflow stomach chi. So a little different thinking. So we're not working to impact your hormones. We're working to impact that counterflow chi. We're working to kind of settle that energy, that chi, and then help the body get back to normal digestive function. Same can happen with constipation with pregnancy. That sometimes the estrogen, progesterone does not like to really work with the body when it comes to bowel movements. And so we can actually kind of help. There's 2 points on the body especially that we can use to help with digestion and constipation. What can happen is sometimes you can get a lot of aches and pains. So let's say a patient winds up with sciatica with pregnancy or low back pain with pregnancy. Acupuncture can help a lot, but isn't necessarily always the whole picture of what you need. When you're pregnant, we can't needle into, a lot of times if somebody has back pain, in addition to needling different spots on the arms or legs, we usually needle into the low back. Well, we can't do that because those are the points that can help start labor. So we don't want to do that while you're pregnant. And that's why what I love so much about our center is that we have a variety of providers at it. So we do what's called physical therapy, which can work a lot with those kind of aches and pains. So if we have a patient who is pregnant and is having sciatica, they can do acupuncture face down, so we have a pregnancy table. We needle into the legs, we needle different spots, but they might also want to see our physical therapist. We do have a chiropractor that does some chiropractic for pregnancy, that's more upper body. We have a neighboring chiropractor who does what's called Webster technique. So what we really pride ourselves on is that if we aren't the provider, that whole picture, we will know who to refer you to. So we know, while our chiropractor doesn't do a specific technique for the low back issues during pregnancy, we know of one who does, that proper chiropractic, who happens to be listening right now. So we have a wide variety of treatments. So things like chiropractic care, things like acupuncture, things like physical therapy can greatly help those pregnancy conditions that happen that maybe your OB only knows it's like a pain medication and you don't really want to do a pain medication. We tend to steer away from using a lot of herbal remedies only because if it goes in you, it does go into the baby. So I'm a very conservative provider. I might suggest homeopathy or different ones that are a lot less likely to impact the baby. But I was raised by a nurse who's an OB nurse and a pediatric nurse, so I tend to be very conservative when it comes to ingesting things. I tend to refer you to your OB. When it comes to any kind of go through any kind of sleep issues or congestion issues with pregnancy, nasal congestion, headaches, any of that. So acupuncture can help with a lot of that as well. As I'm going to kind of speak a little more to acupuncture only because I'm a doctor of acupuncture, but we do have other things, other options out there too. But we have some really, I like to call them, they're not actually magical, but kind of feel magical points when it comes to congestion, when it comes to headaches with fertility, pregnancy, and postpartum. So during pregnancy, a lot of those more public points like large intestine 4, that's contraindicated. That's a point from our medicine that can actually help induce labor. We don't want to do that. There's other points on the body right here that help a lot with headaches. Again, it's a point that can cause labor. So we have to be very, very careful, and that's why you want to, when it comes to pregnancy and acupuncture, go to a licensed acupuncturist. We have a chiropractor who does acupuncture who's amazing, but if you're pregnant, he's going to send you to me because he's certified in acupuncture, which means the training's a lot different than what I have. So you've got to make sure that you are seeing somebody who really knows about all pieces of acupuncture and the theory behind it. But there's a point that connects from the foot to the wrist, and then right here and here, and it works very strongly for helping treat headaches and even migraines when you're pregnant. So we've had patients that have only had that treatment 1 or 2 times, and they haven't come back, and I'm like, oh no, did they not like acupuncture? No, they didn't get a headache after. We also have a lot of patients who get kind of that rhinitis, that congestion in the nose, because as your estrogen increases, so can your congestion. And there are points from acupuncture that can do that. And there's also upper body chiropractic adjustments that can work a lot for the congestion issues. So that's the first part. Now you're working to create the baby. What happens once you have the baby? So anybody here plan on nursing or already nursing? Okay, so milk supply, acupuncture can be very, very profoundly helpful with it. So can the other modalities such as chiropractic, massage. But some things that I really find fascinating about acupuncture is there are actually acupuncture points specific for milk supply. So there's a point SI11 or SI3 that is completely, one of the number one things it does is help increase milk supply. There's what's called cupping. I don't know if anybody's ever heard of cupping, but they're little cups that kind of, a lot of athletes, you'll see those red marks on it. There's certain types of acupuncture combined with cupping that can help increase milk supply. So to date, I've had most patients that I've treated that they're having lactation supply issues, found acupuncture to be very beneficial. Now, we're not lactation consultants, so if you're having a hard time with a baby latching, then we have lactation consultants we can refer you to. So again, we try to kind of have that whole picture for you because, I'm a mom. I know that I felt so overwhelmed with all the information that I needed to know, and I'm in this field. So we try to be that place that can kind of, if we don't have it, we know who to suggest to you. I've also seen a lot of patients with mastitis issues. So I'm trying to be very careful to not talk about scary things postpartum. So, but has anybody here heard of mastitis? Do you know what? So basically it's kind of like an infection that can happen in the mammary gland in the breast when you're nursing. And what it can do is it can kind of make it very painful or difficult to nurse. There are a lot of different conventional things that can be done. Sometimes you really need to go on antibiotics. So it's not, again, it's not saying that you wouldn't need to see your OB, but there are also treatments that we do in acupuncture that are very, very productive for mastitis. And so they're a little more in depth. They usually involves having acupuncture at the chest region, and sometimes even do cupping in that region, and we'll actually sometimes have the blockage get pulled out through the cupping. So it's a little invasive, but usually if a patient is having that, they're kind of cool with, however, they can try to avoid having to take antibiotics if they can avoid it. And I want to back up a little bit. In addition to kind of that mastitis, I kind of skipped over talking about labor and delivery, because most patients, pregnancy patients, are kind of excited about it and terrified about it at the same time. So those of you that are pregnant, is this your first? Is this your second? First. First of all, I want to say labor and delivery is magical, is amazing, and everything they say that you just pretty much only remember holding your baby at the end of it is completely true. So I know I was super nervous when I was having my first one, and then a little less nervous when I was having my second. And for me, I had all the holistic interventions but just due to some things I had to be induced. And so I will say having that holistic piece, I did what's called hypnobirthing, in addition to needing some additional pieces, it was really helpful. So even if I was one of those, had my birth plan, wanted to keep it to a T, most of it had to get thrown out the window, but because I had it ahead of time, the pieces that I could keep were able to be very useful. So I often have patients that come to me and they ask if I can induce labor. We are not obese, we cannot induce labor. That's against our scope of practice. But what there are there's points that move the chi. And when we move the chi in the body, sometimes it can kind of help your body understand that labor is coming soon. So there are points that can also help it, that can help it to be a labor that's more at ease. So again, we're not taking the place of an MD inducing labor, or but we can actually help ease labor. So those points that I mentioned that we can't do while you're pregnant, well, if you're at the end of your pregnancy and your baby is just not wanting to go, there are points that can help remind it, like the LI4, that's a point that helps your body remember it should be going into labor soon. And again, I'm just gonna say one more time, so I don't want anybody getting upset. We don't induce, but we do help your body with, when it's time for labor and delivery. There are also things that we can do, that, let's say that you're having a lot of sleep issues, you're getting kind of at that end of the stage or first trimester. I think every trimester you might wind up having sleep issues, and postpartum you can also have some sleep issues. There's points that we can do. One's a beautiful point called En Bien that you can do that really help reboot your body, called circadian rhythm, that natural sleep piece. There are also, depending on nursing, there's sometimes herbs and things we can offer. But again, if you're nursing and you're nursing every couple hours, we tend not to do herbal remedies. Before I keep talking, are there any interests anybody specifically had questions about in terms of the holistic or integrated piece with pregnancy, postpartum? How about the dads? All right, some of the things that we also sometimes, the women kind of is the star of the show. But we also do offer a lot of acupuncture in terms of just kind of stress level, kind of, that whole, sometimes dads can kind of get that sympathetic pregnancy piece going on. So there are different things that we can do with acupuncture. It's just a very balancing thing for your body. So acupuncture, one of the reasons it works so proficiently is it works with the central nervous system. That's also another reason why we have to be very wise how we do acupuncture, because a lot of times what we're doing is we're kind of stopping that body from being in go mode. I don't know if anybody's ever heard of the sympathetic, parasympathetic nervous system, or that fight or flight. Most of the time we're all functioning in that fight or flight because we're running to a meeting, or we're doing this, or we gotta get the laundry done before we gotta make dinner. We're at whatever place you are in life, we tend to have a lot going on. And so acupuncture works really well at kind of like calming that. It helps remind the body to go back to what's called that parasympathetic functioning, kind of where that your body takes over versus your go takes over. And that's one reason why it's so relaxing, but it's also another reason why it's so productive with pregnancy. What we've found is that when you're receiving things like acupuncture, chiropractic care does similar things with that central nervous system, we actually get more oxygenation and blood flow to the uterus. So we're actually nourishing the mother and we're nourishing the baby. We have some things that it's just kind of like one of those things where you just kind of kick back, meditate for a half hour, which when you're pregnant, having that ability to just kind of relax doesn't always happen. At our clinic, we also, as you get more pregnant, laying flat isn't the best option for you. So all of our beds our pregnancy beds all have the ability to tilt up. So those are some different things that we do at holistic healthcare centers. But I'm going to kind of use that to bridge, unless anybody has any specific questions about postpartum care, pregnancy, labor and delivery. Any specific questions? No? Gabriella, do you have any questions? Erin, do you have any questions?
I don't have questions, but I just wanted to quickly say I've been a patient of Dr. Kimberly's for 2 years now, and I have nothing but amazing things to say about her and the other acupuncture doctors that work at her facility, and even the chiropractor doctor. I'm kind of seeing them all. I saw her with my first pregnancy, and now I'm seeing her throughout my second pregnancy, and she's been able to help alleviate symptoms that other doctors haven't been able to. But yeah, I highly recommend.
Thank you very much. And do you mind if I mention the one thing that we're currently focusing on?
Oh no, go ahead.
It's okay with you?
Yeah.
So right now she had this in the first piece, and she's having it now is sciatic pain. And like I mentioned, we can't needle. The points that I love to needle for sciatica, we're having an issue needling, and she was in a class. It just kind of came on out of the blue. And so we're having a lot of productivity with acupuncture, but something I've learned is that a lot of times you can resolve an issue much faster if you have a team versus, if you're just kind of doing it yourself. So that's where we bring in the physical therapy. We bring in the chiropractic piece. So that way, what might take, several treatments with acupuncture, we might get it done in like a week or two to kind of get that symptom to slow down. Another piece, though, that we use a lot with all of our patients, but especially our pregnant patients, is energy therapy. So has anybody ever heard of Reiki or healing touch or somatic? Well, I guess somatic experiencing isn't, but have you ever heard of any of that? So energy therapy is a really productive way to help with relaxation. It offers a lot of physical healing too, but it works with the chakra system. Has anybody ever heard of the chakra system? Okay, so chakras are like these little energy centers that we have in our body. So with certain, I think there's a woman with a camera that kind of takes a picture of your magnetic field. You can probably actually see some of the chakras. We now have enough science that we can actually see these fields in our body. Before it was all just theory, but with science and development, we're now actually able to kind of take pictures of these different centers. So we have these different chakras in our body. What's called a root chakra, a sacral chakra. So it goes all the way up to the top of our head. And by working with these energy fields, kind of like how acupuncture works with the meridians of the body, and with what's called our magnetic field, which again used to just be kind of more woo-woo, where we're like, that. Now we actually have science that can actually measure the magnetic field of our body. We can measure the magnetic field of almost anything at this point in time. So what I found a lot with patients who are pregnant, they tend to wind up, there's a lot going on, a lot of changes. So we work with the energy works piece. And by doing that, we're able to kind of help bring that calmness, that relaxation. And that's something you can do at home too. So something we like to do is also give you things that you can do at home. So that way you're not just dependent on us. Plus, after you have the baby, if your postpartum care is fabulous, you don't need to come back to see us. So with while you're pregnant and after you're pregnant, you can do things like a self-chakra connection, which is a form of healing touch. That's I'm a healing touch. I'm trained in healing touch, and that can actually work to bring balance to your mind, body, spirit, and emotions. Something that we see, and I'm going to teach that in just a second. Something that we see, I would say with some of our a lot of times our patients that have been getting acupuncture throughout their pregnancy. I haven't really had too many that have experienced postpartum depression to severe, but anybody can experience postpartum depression or baby blues, no matter how wonderful life is, because it's not anything to do with the mother and her emotions and her thoughts. It's to do with the chemical balance of the body. So a lot of times we used to think that it was the mom, not connecting with her baby or not. No, it's really the body's not shifting the hormones the way that the body needs to, and not letting the mom kind of get back into her normal mood and personality. So while we use acupuncture strongly for postpartum issues, we use herbs. Again, of course, we often refer to a talk therapist, or we'll refer to an OB, but we also use energy therapy. So again, that energy therapy is that chakra system, the magnetic field. So if you're up for it, I would love to teach you a self-chakra connection. And then let me just move this table back. Don't look at the child behind. And I will, I meant to bring them, but I wound up not. So if you like this, my information is on the card. There's a QR code that you can scan that gets to our website, a QR code that will have this presentation on our YouTube channel. If you want me to show you you can just Google Healing Touch Self-chakra spread. There's a PDF online, but I can also email you one if you have any interest. She's like, I didn't know I was coming to be a cinematographer. All right, so the self-chakra connection can be done all ages, anybody. I mean, my son started doing it when he was 2 years old. So it's something that is just really good at balancing the mind, body, spirit, and emotions. It is fine, it's comfortable for all religious beliefs. If you have any kind of spiritual belief system, you can always include prayer with it. You can always include kind of that higher mind piece. And if you don't, then you can just kind of, think of positive thoughts. The main thing is that you're wanting to think of kind of something calming. So if you're stressed, if you're worried, let's say you're 38 weeks pregnant and you're very worried about labor and delivery, I would not suggest thinking about a peaceful delivery, because inside you're still going to be worrying about delivery. So I would think of what pizza you're going to eat that night, like something that just kind of puts no thought or emotion. So what you want to do is you kind of, if you can't reach, so that's the fun thing, you can do it by kind of your intention. So I'm going to show you how to do it, but you can also do it by just kind of thinking, like envisioning, like kind of so basically you would put your hand on the bottom of your foot and on your ankle, or you would I'm going to ask you guys, just kind of, if you can't reach, just kind of imagine putting it, and then what you're going to want to do is while you're sitting there, just take some of those deep belly breaths. Now you probably aren't going to notice by in and out the belly breaths, but the deeper your breath is, the actually better when you're breathing, it actually can help your body be in a more what's called an alkaline state instead of acidic state. So those deep belly breaths actually help with the pH of your body, because it's helping with the oxygenation carbon dioxide balance. So I know all the men can do this. So if you want to kind of put your hand towards the bottom of your foot and your other hand on your ankle, and you just take some relaxing breaths. I like to think of relaxing thoughts. So for me, I like to think of nature. I like to think of my kids playing. So whatever kind of is in your comfort level. So you're going to just take some deep breaths, holding your hand there and just thinking of relaxing thoughts. And then I'm going to walk us through it a little bit faster, but you can sit up holding it up to 5 minutes if you want. Let's say you're having a really stressful day. You can just kind of sit and just be in that meditation moment. And then after your hand is on the bottom of your foot, you're going to move it up to your ankle and to your knee. And so what we're doing is we're connecting chakras. So these are kind of like smaller chakras right here. And let's say that you're having knee pain. In this moment, you can really take some deep breaths, whether you're actually holding your or you're imagining it. And you can just imagine blowing out the pain. So you just kind of take those deep breaths. And you just release that all. You release the day in the moment. And then you go to the knees. So you kind of walk your hands up to your hips. And you take those deep, relaxing breaths. See, I heard a relaxing breath. And now we're going to switch to the other side. So the bottom of the foot to the ankle. Erin, you can still. I'll take some deep, relaxing breaths with it. And you can always close your eyes, because I'll walk you through where you're placing your hands. And you can imagine breathing in white or lavender energy through your nose and breathing out gray through your mouth. And the concept behind that is white and purple energy is considered to be a very, very healing energy. And so you're bringing that into your body, and the gray is kind of breathing out any stress. And now we're going to take our bottom hand and put it on our ankle, and take the other hand to the knee. Take those deep breaths. And for those not pregnant, to know if you're belly breathing, instead of breathing in our chest, that chest is that fight or flight, that sympathetic breathing. Parasympathetic, that more relaxed breathing, is down in our abdomen. So you'll feel when you take your breath in, your abdomen actually goes out. When you exhale, your abdomen goes in. So now we're going to take our hand from the ankle onto the knee and the other hand onto the hip. Take some relaxing breaths. And now we're going to place both hands on our hips. And I know when I was pregnant, something I really like to do is I like to imagine really connecting with my baby right here. I like to imagine sending love to my baby, and just kind of having that moment. And now we're gonna take one hand, it would be basically at the base of the body, you can just kind of set it there, and then one hand right underneath your umbilical button, your umbilicus, your belly button umbilicus. And then we're going to take the hand that was on the base and put it on the top of the umbilicus. And again, this is a really good time to have that connection with your sweet little baby. And then we're going to go on above where our spleen is. So you're going to take your left hand and put it right above the spleen. Just take those deep breaths. And you're going to continue to leave your hand right above the umbilicus, and you're going to go up to your chest. And this is, again, this is kind of the energy medicine. Those of you who are nursing or are going to be nursing, you can kind of, and this might sound strange, but you can kind of just send positive energy, loving energy, into the chest region. So that way for that milk supply. Through so many studies, we're learning that what we think impacts how our body functions. So sending kind of that positive energy into the chest. At worst, it doesn't do anything. At most, it helps. And now we're going to go right, it's called high heart, right above. So holding one hand at the chest, one hand right above. And now wrist to wrist. So you're going to give yourself a big hug, basically. And elbow to elbow. And shoulder to shoulder. And again, you can do this slower, but. And now we're going to go back to that high heart and chest. And now each chakra has to do with emotions. So as you're holding that there, I'm going to kind of run you through the different emotions associated with each chakra. So at the base of the body was our root chakra, and that has a lot to do with sense of belonging, and it comes with the color red, kind of you're rooted in life. The second chakra, fertility, pregnancy. This chakra, third chakra, has a lot to do with how you feel about yourself in the world, and that's where a lot of times when somebody's feeling insecure, they can feel like they have a pit in their stomach, or they're nervous, they kind of feel it in their stomach. In energy medicine, it's because that's that chakra kind of taking on those emotions. The heart chakra has a lot to do with your way that you connect with the world and love for the world, that kind of that united feeling of energy. And then this is our throat. We're going to lift our hand from the chest up to the throat. This has a lot to do with using our voice and our sense of control. Sometimes, there's a link when people have thyroid issues that they also feel like they often didn't have control in life or weren't able to fully use their voice. So there's a lot of connections with kind of where we hold energy and then physical ailments that can happen. So if you have, sometimes people during pregnancy can kind of have the issues with their thyroid, this is that chakra that gets impacted by it, and it's always great to kind of just hold and what's called Qigong medicine, that's another form of medicine. There's a thing called an inner smile, where you actually kind of like imagine smiling at all of the different parts of your body. So you just kind of think positive, keep holding positive thoughts while you're holding your hand there. Now we're going to go to our middle brow. Some people call it the third eye. This is the chakra that is considered to kind of hold a lot of intuition and a lot of connection with the universe. And now I'm going to hold that for a few minutes. Now we're going to go to the top of the head. This is kind of where you start connecting yourself with, if you believe in a higher power or just the universe as it is. And so we kind of start to kind of work to hold that energy, connect it, keep it calm. And we're going to take the one on the brow to the top. And this is kind of what we would consider universal energy. If you have a belief in a higher power or God, this would be kind of sending that energy up there. So whatever belief system you hold. And then I like to just kind of imagine as I close it like a little bubble around me. Like, this is my bubble. You cannot come in my bubble unless I say you can come in my bubble. So that would be a self-chakra connection. It's really, does anybody feel a little calmer after sitting and doing that, or do you feel kind of just the same? Calmer? So, and I know that like when my kids have done it before bed, even if they are not ready to go to bed, if they do it, all of a sudden they'll start to see yawns. It doesn't mean that they don't protest trying to go to bed, but all of a sudden it kind of takes you from that fight or flight into that more parasympathized to your yawning mode. So we're understanding the science more and more behind things like healing touch, but regardless of why it works, what we do know is it has a positive impact. So we do know that that meditating, that kind of having that calm moment, that deep belly breathing is positive for you, is positive for your baby. And when you have your baby, and your baby might not be sleeping, or your baby is, keeping you super active, even just doing that while you're in the shower, sometimes showers don't happen postpartum, but even doing that just a little bit each day can make a big difference. So even if you take 1 minute and just kind of in your mind go through it, or before you get up, or after you've nursed. So these are some things that can kind of help with that mood, with that postpartum piece. Does anybody have any questions? So when's everybody due?
Next one.
That's so exciting. And you had your baby, and then you guys are in March. Their babies are similar to when my babies were. When are you guys doing? Oh, that's exciting. There's a winter baby. And I know when you're doing. When are you doing? All right, well, if you have any questions, let me know. If you get a chance, definitely check out our website. If we're really big on families, we're actually expanding. So we're taking over, we just took over another part of the 3rd floor. So we'll be having a ribbon cutting in October, which she probably will not be able to be at. But it's something that if you want to come, we're going to be having raffles for free massages and stuff like that. So thank you so much for coming in the city.
Thank you. Thank you.